Hey you guys, welcome to the Dr. G Show. I'm glad to have you guys here. As you guys join, please feel free to share and like the post that we're doing today. I want you guys to kind of drive the conversation, and we'll talk about this a little bit more as we go. Now, as you guys know, I'm Dr. Garrett. I am a DC, and I have 4 postdoctoral diplomates, and I practice functional lifestyle medicine. And typically we have a topic that we're going to go over, and today we're going to switch it up though. So we were supposed to talk about epigenetics. We were hoping the tests would get in, but they weren't in. And then we were going to have a special guest, Connie Paraska, and unfortunately she was double booked, and she ended up having to change the schedule. So instead of talking about kind of emotions, thought process, neuroplasticity, epigenetics, tonight we're going to talk about reflux. So we're going to go visit an old topic that we talked about a long time ago, maybe a little few new things on there. But as you guys join, please feel free to ask questions, any kind of concerns that you guys have. You get to drive this conversation. I'm going to kind of lead the way and go in a certain direction, but as you guys have questions, please feel free to post those. And thank you guys for joining us tonight. So, all right. A couple things that we want to do in the next couple weeks, the next month or so, is we want to have a wellness retreat for women. So we want to do a pretty much an all-day kind of maybe 12, 13-hour thing where we do meditation, yoga, teach mindfulness. We're going to have kombucha workshop, and then we'll have a hormone workshop. So basically it allow a group of people to come in, and we'll start off practicing mindfulness meditation, and then we'll go through the process of being able to attend different classes and having little breaks. And then we'll end with either meditation or yoga. So if that's something you guys are interested in, let me know. And then we also need to be planning another shopping trip. And then we're also in the kind of midst of planning a documentary kind of club, book club. We used to do that a long time ago, but that's something I would like to start again. So we usually talk about, pick a book, and then we go through that book over a few weeks, and half the people don't read the book, but just attend so we can talk about it. And then we usually end up watching a documentary, and then we talk about the documentary. So the nice thing is, like, it's that right tribe kind of mindful group where we're all on that same path. And the last few times we've done this, people actually brought in healthy snacks and treats, and so we kind of got to experience different things that people do that we could then say, okay, I want to do that too. So that was kind of nice the last few times that we've done this process. So women's retreat, and then shopping trip, and then our book documentary club that we want to start again. So tonight we're changing plans. We're not doing the epigenetics like we were going to, because Connie's not going to be here. We'll have to reschedule her. She's fantastic. But we're going to talk about reflux. So as you guys have questions about reflux, let me know. Otherwise, I'm going to ask you guys questions too, and then feel free to post those. I'll try to answer them either now or over the next week or so. But who here has had reflux before and knows somebody with reflux? It tends to be quite a few people. It's a GI condition, it's kind of like a acid reflux or heartburn. They call it gastroesophageal reflux disease, or GERD now, so it has like a really good, bad sounding name. But it's all the same thing. It's just a little bit of leakage of acid up into the esophagus. And then what we want to do is figure out why that is, and then stop doing that. So, Brianna says she did, and her DH did too. Digital husband? I'm not sure what that means. Both of us took meds in the past, yeah. It's one of the most common symptoms that people come in for your primary care office. So the statistics on this for Americans, and again, Americans are way different than the other countries, but 44% of Americans will suffer episodes of reflux. So they'll kind of have off and on or consistent. Oh, DH's darling husband. That's so sweet. You're like honey, see? And then 20% will have chronic reflux. Now, I suppose we see probably more than that, but that's 1 in 5 people have chronic reflux. Half of people have episodal reflux. 50% of pregnant women will have reflux. So again, do we want to give medications to pregnant women that have a developing baby in them that can be affected, or do we want to just get rid of it naturally? And then 50% of reflux meds 50% of reflux patients will end up on medication. So again, it becomes one of the second largest prescribed pharmaceuticals that we have, next to things like Lipitor. And reflux rates in so it's about 50% in the US, 40%, something like that. In Asia, it's 2.5 to 6%. 2.5 compared to every other person you know. And then in the Middle East, it's very sparse, so it didn't even really make the cut. And then in Europe, it actually grows to about 31% acute and then about 10% chronic. So they are just under us, but still pretty far under us. All of the rest of the entire planet pretty much is less than America. And so when we start to talk about why we have reflux, it becomes very noticeable or obvious that, we should have reflux. So, hey Carla, hey you guys, hey Jenny, thanks for stopping by and watching. Feel free to post, share this with your friends, and share this on your Facebook feed as we go through this. I really appreciate it. There's free information for you guys, and you guys get to drive the conversation, so please feel free to ask questions as we go along. What's really interesting is, pretty much, if you know me, if you ever been to my talks, we always talk about the cause of disease. And so if you take like a map and you say the number of people that have it over time, pretty much all disease is like very low or rare, and then boom, there's a sudden epidemic, and then we maintain the epidemic. And guess what? Reflux? Not any different. Reflux kind of is like this, kind of like you see in other countries, just very low, very small amounts. But by 1994, that's when reflux just skyrocketed. And so 1991 is thyroid cancer, 94 is reflux. And the 90s, one of the interesting things that happened in the 90s, there's two things that happened. Is one, we started putting sugar in everything that didn't have sugar before. So they had, back then, tech stocks were blowing up, and then the hedge managers looked at other stocks and said, all right, food industry, you guys make a lot of money, but you need to make more money, right? Because that's the whole goal of America, is make more money at the cost of everybody else. So they got this great idea. Sugar is more addicting than crack. What if we just start putting lots of sugar in stuff that never had sugar in it? And then the stuff that had sugar in it, we'll put a lot more sugar in it. So all of a sudden in the 90s, you see thyroid problems just skyrocket because of that. It's secondary to chronic stress or cortisol release because of all the sugar. But you're going to see the same thing start with things like reflux, because sugar is a big one. The other big thing that they did in the 90s was that they said, well, another way you can make a lot of money, and Brianna said her stuff started in the 90s, which is funny, because again, it goes right with that. And Jennifer says she'd love to get off her proton pump inhibitors, but it's super easy. Like reflux should be like, ready? What? That easy to fix. Like it really is that easy to fix. And I'll explain why. So Jennifer, kind of stick around, and we'll talk about why you have reflux and how easy it is to get rid of reflux. And again, long term, see Brianna, super easy. She knows what I'm talking about. You know what I'm talking about. So the other thing they did in the 90s is they said, what if you turn your waste products into new products? So all of a sudden we had all these kind of waste products reconverted into products. So we really saw this spike of things where we were looking at food that isn't really food anymore. And that chemicalization of food drove higher profits, but at the cost of our health. Yeah, so Lisa knows, right? Newman knows. So, all right. That easy to fix. I love reflux patients because it's just like, your world's going to be better, and then I got to find another patient. So, Journal of Pediatrics, is it just a kid's thing or just an adult thing? Which it used to be, but hell, let's just make it younger and younger, like every other disease we do in America. So, acid reflux in children, especially babies, has increased 16-fold. And there's no medical reason for the sudden epidemic, which means it's not suddenly kids are born with some type of, GI disease, or their stomach is above the esophagus, which that's a tougher patient. That's not a simple fix, but that's the very rare cases. So what that means is we have this sudden, just huge epidemic of babies and children getting reflux, but no medical reason, which means it's back to diet. It's the lifestyle. What are we doing to cause it? So, what's interesting is when you look at the top 20 drugs that are prescribed in the U.S., listen to this, okay? So we'll go through these. But the number one is Lipitor for cholesterol, which is horrible because cholesterol drugs are one of the most damaging drugs you can take. And plus, countries with high cholesterol have fewer heart attacks, less than, like 70% less. Countries with low cholesterol have more heart attacks. And in fact, the ER says that 70% of people coming in for heart attacks and stroke have below 200 cholesterol artificially, so you're more likely to have a heart attack with lower cholesterol now, which that kind of sucks. So, and Brianna says, can you believe that they gave my mother-in-law a proton pump inhibitor for a chronic cough? Yeah. So there you go. You give the ACE inhibitor for the hypertension, it causes chronic cough, then you give the proton pump inhibitor, and then you're super nutrient depleted. So, so the number one is Lipitor, which we shouldn't be doing. Then we have Nexium, and Nexium is reflux. So you can think like, okay, if it's the most prescribed drug, then yeah, it's half of everybody is having this stuff. Then Plavix, because we're back to stroke and heart attack, and then Singulair, which is allergies, then Lexapro, which is depression, then ProAir, which is asthma and allergies, then Synthroid, which is thyroid, which is secondary to cortisol, then Crestor, which is, they should have took that off the market by now, which they came out and said that Crestor is no more effective than doing nothing, but more harmful. So they should never use Crestor. Now, when they came out with that, Crestor had an ad in our local paper in Newton, Kansas, that said Crestor is so effective. And then when you looked at who wrote it, it was the guy that worked for Crestor. It was some scientist that worked for Crestor. So that when it came out national news that said it's harmful, just like with all these opioids, right? They came out and said opioids are no more beneficial. That new study just came out. No more beneficial than other non-toxic treatments or drug remedies that aren't opioids. And so, of course, you're going to have new articles come out in the paper and they'll be like, well, actually, this opioid's the best. So, same kind of nonsense. Then you have Advair, which, of course, is asthma and allergies. Then you have Divan, which is blood pressure. Then Cymbalta, which is depression. Then Effexor, which is depression. And so, then you have Chloricon, which is for the side effect of the medications. And then you have Prevacid, which is the other big proton pump inhibitor. And then you got blood pressure, and then diabetes, and then Flomax for prostate, and then Seroquel as antipsychotic for the antidepressants that don't work. And then you have Levaquin, which is infections. Finally get to infections. So that's pretty messed up. So if you look at those top 20 drugs that are prescribed, it tells you a whole hell of a lot what's going on in America. We're just inflamed, and we have lots of depression and exhaustion. That's all it is. So, all lifestyle stuff anyways. So, when you look at the typical type of treatment, The typical treatment for this is proton pump inhibitors, which a couple of you guys have mentioned. So a PPI, or proton pump inhibitor, is what the treatment is, because they say it's acid causing the burning. We don't need acid in the stomach. That's crazy talk. So let's just get rid of acid. We don't need acid. Just get rid of it. God was wrong. You know how he is. He's always putting all these extra parts in us that we got to chop out, and get rid of the acid. We don't need that, right? So, turns out, acid's pretty important. There's a reason for it, right? One of the big ones is that you produce 10 cups of snot from your head that goes down the back of your throat. And that's when you're not sick. 10 cups. And that 10 cups of mucus breathes, so every time somebody's hacking and coughing and you're breathing in, it sticks to that fly paper oozing down the back of your throat. And then it drops in that vat of acid, and the acid kills that bacteria, virus, fungus, parasite, yeast, all that, right? So we don't get sick. But if we get rid of the acid, could cause a problem, right? Could be more sick more often. And a proton pump inhibitor does not get rid of a little acid. It doesn't lower the acid. It obliterates the acid. 99.9%. And that's why the Iowa formulary says this is one of the most risky medications to do, because it affects everything after that. If you think about like your brain, your nervous system, your heart, everything is dependent on what can you break down that you put in your mouth. But first you have to eat healthy things. Then you have to be able to break those things down, which acid is the second major step in that process. And then you have to absorb it very quickly. Your first 18 inches after the stomach, that's when you get the most absorption. You get 22 feet of small intestine that's spread out over an entire football field cell to cell. So we have a tremendous volume of absorption, but really we can cause a big malabsorption syndrome, and then people just fall apart. This falls apart, that falls apart, and then you trace it back and you're just like, yeah, that's what should happen. You're getting rid of the acid. You're blocking the oxidation process for iron. You're preventing calcium and magnesium from breaking down, so your bones should get weaker, your muscles should get weaker, nervous system should slow down. And it also, the same pump that pumps out acid or hydrogen protons also produces something called intrinsic factor. And intrinsic factor is what you need to bind to that B12 so that you can then absorb it into your small intestine. B12 is not cool enough to get in the party by itself, right? It's that guy that's kind of like, he's kind of cool, but not quite cool. So he needs this hot mama to come with him, and then boom, he gets right into the club. So that hot mama's intrinsic factor, or well-educated, that's why she's so hot, right? So that gets him into the club, and then all of a sudden you make blood cells properly, you have energy, you feel great, it's the original antidepressant, life is awesome. But if you get rid of 99.9% of the acid production with those proton pump inhibitor medications, then suddenly you should be depressed and have mood problems, and that's what converts, homocysteine into SAMe, which then converts serotonin into melatonin for sleep. So you should have sleep problems with that. You should have mood problems with that. You should have higher risk of heart attack with that. So energy, everything slows down when you screw up the intrinsic factor. Folic acid is messed up, and that's your brain function, your memory. All that phosphatidylcholine and serine that people spend a lot of money on, that's a natural pathway. The methyl tetrahydrofolate reductase pathway, which is one of my favorites, right? That is regulated through that acid too. So that basically, that's a complicated way of saying folate becomes brain function through that pathway. It becomes happiness. It becomes serotonin, melatonin. It becomes epinephrine, norepinephrine, dopamine to make you feel awesome. But if you prevent that from absorbing, then everything falls apart and you feel sad and unhappy. And zinc is one of the things that's malabsorbed in that because it needs the acid. Same with beta carotene to prevent skin cancer. So blocking that proton pump inhibitor is going to put you at high risk of cancer. And of course B1, which is amazing because that's what your brain works off of. B1 or thiamine is what actually converts sugar into energy into your brain. And if you don't get that, then you can create something called Wernicke's encephalopathy with Korsakoff syndrome, which you get dementia and you brain foggy in the beginning, but really you can stop making memories. You can do what's called confabulation. It becomes crazy mess. And people think of alcoholism. They don't think of malnutrition because of proton pump inhibitor, because never in our society have we ever done that. So now we're this kind of giant experiment going on to see what happens when we cause these nutrient deficiencies. So we also said it breaks down bacteria and oxidizes iron. It regulates the pH. I know a lot of people like to do pH diets, kind of mess around with stuff. But the reality is, whatever you put in your stomach is no more acidic than that stomach. So literally, the most acidic thing that you're consuming is actually more basic than your stomach. So don't worry about all that mess. Just eat real food. Eat healthy food. Jennifer says, "Ugh, oh my God, this doesn't sound good." No, it's good. It's good because we're going to talk about the simple solutions to fix this. Right? The medication sucks. It's one of the worst that you could take next to statins. But the solution is very, very simple. So what we mean by all that basically is, if people take proton pump inhibitors to counteract their lifestyle, they should fall apart. Everything should fall apart, and systematically they should be going to 12 different doctors, 12 different specialists. No one knows what's going on, and they all just medicate for those symptoms. And then they eventually will come see me when it all falls apart. So, reflux is not about acid. Hey Rhonda, how you doing? Hey, good to see you, Bruce. So reflux is not about acid, right? If you flip, well, we'll talk about this, but the stomach's a bag, and it has two sphincters on either side, so two fist-like grips. You have a grip at the top, so food goes in the esophagus, goes through here, into the bag, which is the stomach, and the sphincter at the bottom prevents it from going down any further. So, open when we eat, closed when we eat. Then, after you eat, it closes, and both those fists get really tight. And that bag of fluid, of acid in there, and enzymes just start churning and breaking stuff down. And it'll sit there like a little washing machine for about 2 to 4 hours to break down all those things so we can rapidly absorb things as fast as possible. Then, when it's ready, this one gets super tight, right? Kung Fu grip tight. If you play with G.I. Joes. And they should get a Kung Fu grip Barbie, right? She like choke people out and stuff, right? That's what they should. Well, as a kid, I had sisters, and so I had to play Barbies. So my Barbie always ended up crashing her car and starting fires and there's earthquake. It was always drama. Because all they do with their Barbies is just and I'm like, G.I. Joe, fire! So I played Barbies like G.I. Joe. So that might explain a lot. So Kung Fu grip. So you have this Kung Fu grip at the top because we don't want food to go back up through the esophagus, and then we have this pyloric sphincter down here that loosens up. Right? It becomes loose. Then the stomach squeezes everything down and out into the small intestine. Very quickly, there's a buffer that's sprayed on there to prevent the acid from damaging the small intestine, which is why the pH diet doesn't matter, because too much acid, it'll buffer that. Too little acid, it'll buffer less of that. It'll all become the same thing once it hits the small intestine, because we don't want to damage the small intestine. So, that being said, if that stomach's squeezing out all the stuff and some squirts up, is it because of acid, or is it because the sphincter is not doing its job, right? So you can see, bam, really strong, right? Hans and Franz, right? But that's probably unnecessary. This is how I talk with patients, So if my grip, and I'm trying to open that jar and I can't open the jar, is it the jar or is it my weak arm, right? And so it's my weak arm. So if my sphincter, my grip is not tight, because these muscles, It's my arm's problem, not the acid's problem. The acid's there, it's doing its job, it's supposed to be there. Brianna says, where does the pancreas do its job? So you have the sphincters, and then you have like a little, maybe inch or so, and you have this little hole called the sphincter of Odie, like Garfield and Odie. And then that one goes up and divides, and one goes to the pancreas, one goes to the gallbladder. So then gall juice is squirted out, pancreatic juice is squirted out. So as soon as the acid's broken down, when the acid breaks down, it goes through, and then it gets all those sprayed at it, and then it breaks it down. So like within an inch or so, that's where the pancreas starts doing its job. All right. So if that muscle at the top is weak, and that's really to blame, the lower esophageal sphincter is not doing its job. Why? Why is it not doing its job? Why is it not as strong as it's supposed to be? Right? Why is it weaker for Americans? Are we just number one in the weakest sphincters in the world? We're number one in childhood obesity, childhood infant mortality, obesity, diabetes, cancer. Why not be number one in lower esophageal sphincter weakness? Okay, maybe not that. So the way this works is that you have two different nerves coming to this sphincter. You have a nerve from your spinal cord, or from your brainstem. In your brainstem, your myencephalon, metencephalon, rhombencephalon, right? Telencephalon. So, well, not telencephalon because that becomes your brain. So your brainstem has a nerve that comes out called the vagus nerve. So what stays in Vegas, what happens in Vegas stays in Vegas, right? That nerve comes down, and that goes to all your intestines and your bladder and uterus and all that junk, right? And that that vagus nerve says, do your damn job, right? So heart beat 60 to 100 beats per minute. Lungs, 12 to maybe 14, 16 breaths per minute. Gut, poop out what you ate about 24 hours ago, or 9 to 12 hours ago. So food in, food out, food in, food out, right? Creates a rhythm. It's called circadian rhythm for the most part. But that's the vagus nerve. That's the one that says, look, do your job. Grip really tight. Don't let acid squirt up, because we don't want to burn ourselves. That's ridiculous. But, real quick, Christy, she asked about hiatal hernia. Now, hiatal hernias, that's where the stomach is just above the diaphragm, and then that will have acid trapped in there. Now, that one, they just need to pull the stomach down, put an extra stitch in there, you're done, right? That's a fix. That's more of a surgical fix. Now, there are, especially chiropractors that specialize, maybe some PT, that specialize in trying to push down the stomach past there. I don't do that. I don't know. But hell, it's way better than surgery if it works. So, and I've heard a lot of doctors talk about that they can do that. So that would probably be, if I had hiatal hernia, go to someone that does that. And then if that works, great. If not, then just pull it down a little stitch and you're good. It should just be the little punctures that they do, so it's not that big of a deal. Yeah, soft tissue manipulation works very well. Yeah, see, that's good. So we said that the parasympathetic nerves from the vagus, that they will tell the sphincter to hold tight. Do your job. But we have another nerve coming from the spine. So you have the spinal cord running down the backbone, and just on each side of that, inside the rib. So if you pull the lungs out, you can see these little pearls and a little line, and that's called your sympathetic chain ganglion. And those nerves are sympathetic, and they go to all the same places, but they tell the body to do the opposite. So if they go to your heart, the sympathetic or parasympathetic from your brainstem says, hey, beat normal, but your sympathetics from your spine say, go over 100, it's fine. So you're sitting there just for no reason, right? So that could be a nice big problem, right? That's sympathetic overdrive. So if we're talking about that sphincter, and we have a sympathetic nerve that says loosen up, and we have a parasympathetic that says tighten up, then it's a fight to see who's going to win. And if we have overstimulation of sympathetic nervous system, then that tight fist, kung fu grip, gets a little weak, right? And then when that stomach starts trying to squeeze that acid out, a little bit shoots up, burns the esophagus, and it's very painful. Acid reflux. Now what's interesting is if we do the same scenario, and we take the stomach and we say it's the bladder, and then we have the urethra that goes out, urethra that goes out, then we have our bladder, and then we have your ureters that go up to the kidneys, right? That thing has a sphincter at the bottom too. That sphincter says, hey buddy, don't pee yourself today. It's going to be a good day. So I'm not going to pee myself. My sympathetics from my parasympathetics from my brainstem through the vagus nerve goes all the way down and says, you're not going to pee yourself today, Patrick. It's going to be a good day. But then your sympathetics from your spine, your sympathetic chain ganglion, comes by and says, you should pee yourself. It'd be awesome. So who's going to win? Well, most of the time, not going to pee myself. But what if somebody comes up and scares me? Now, I can't be scared because I'm a man, but, well, there are some things that scare guys. But if I, go around the corner and someone goes, ah, like this, and it scares me, that sympathetic overflows, and then that sphincter that says don't pee yourself loosens, and then I pee myself. If you flip that back upside down, that's reflux. That's the exact same mechanism. Now, if you're peeing yourself, what do we do for medication? Don't let them pee. Don't let them make fluid, because that's how you fix that problem. But urinary incontinence and acid reflux are exactly the same, different sides of the same exact coin. It's the same mechanism. It's the same sympathetic overdrive. So then you might be asking yourself, what raises sympathetic nerves? And this is where you go, okay, this is going to be a pretty simple answer. This is why it's that easy to fix reflux. Because reflux is not a disease, it's a normal and expected outcome from an abnormal diet or lifestyle. So the very first thing, caffeine. So caffeine is a stimulatory, and caffeine in white tea, yellow tea, green tea, it's 15 to 25 milligrams. That's not going to do it. But once we get to soda, that's 35 milligrams, which is the same as chocolate. Now, chocolate will cause that sympathetic nerve response, not just from the caffeine, but also because it's chocolate. So some chocolate, good, but most people are eating milk chocolate, which means lots of sugar, lots of dairy, and pretty good amount of caffeine. So, of course, it's that trifecta of, I'm going to eat a Hershey's candy bar and pee myself and have reflux, right? Have little dribbles, just a few dribbles. It's fine. Because that's what happens when you have a baby in America, but not the whole rest of the entire planet, and animals don't have that either. And it's more just in last, say, since the 90s. Makes a lot of sense. It must be that same food. But so, or have the babies, that's the word. So, caffeine will do it. Now, if you look at black tea has 50 milligrams of caffeine, but that's for a little cup. But what do? We go to Sonic and we get that estrogenic styrofoam with that 44 ounces of black tea. Suddenly you have enough caffeine in there to not only cause general anxiety disorder, which is basically the same thing as the reflux in your brain, but also to cause reflux. And so most people will think, oh, I'm drinking this and I'm getting reflux. If you look at your typical, yerba mate tea, That's 85 milligrams, which is the same as Red Bull. Now we're getting to the part where we can actually put people in the hospital for heart conditions or send them to the ER. Then a Monster soda has 160 milligrams of caffeine. And then a coffee, just a small coffee, 1 cup, has 100 to 200 milligrams of caffeine per cup. Which means if you get a venti or even a tall mocha or whatever, just a coffee, that's enough caffeine to cause anxiety for no reason, general anxiety disorder, but also reflux and urinary incontinence. What's really funny, so I love telling embarrassing stories about me to help you guys. I used to do lots of lectures. I lectured all over the country. I had software that was used all over the world, and I talk about applied nutrition, clinical chemistry, teach continuing education, laboratory interpretation, clinical nutrition, functional medicine, all these kind of things, right? So being in front of people doesn't bother me. Talking to big crowds does not bother me. But for some reason, for a while, there was a few seminars I went to where I thought, I'm going to like pee myself a little bit. And I was like, what the hell's going on? And so I was just sitting there thinking, like, what's the difference? What is the difference between when I don't or I do? But I would be sitting there lecturing the whole time thinking, did I pee a little bit? Did I pee a little bit? I might have peed a little bit. Damn it, how old am I? Like, am I 80 or something? What's going on here? And so come to so come to find out, just talking raises epinephrine, right? Which is that sympathetic nerve, which is a little bit of fight and flight. But I was also writing, usually if I'm doing a 12-hour seminar, I might write like 700 slides. And so I not only had to know everything that they knew, but I had to know more to convince them that my way is the right way. So I ended up having like 700 slides for these seminars. And so I would be just exhausted by the time I got to present the seminar. And so I was just drinking lots and lots of coffee to try to get my pep up, right? Because I wasn't all about B12 back then and B6, which would have been smarter. Same with attention, energy, without the crash and not peeing yourself. But I noticed when I drink too much coffee before a lecture, I would have a hard time. Like I had to really struggle to not pee myself a little bit, like those few drips or something like that. So, same problem for other people, it's reflux. So how did I solve that problem? I stopped drinking all the coffee before I go to do lectures. So then all of a sudden, I didn't have that issue anymore. It was that easy to fix. And during that time, I'd have a little reflux here and there, depending on what I consumed. But that was very easy to stop. It was just crap back then. But then you have nitrates, and nitrates are in processed meats. So what we do in America is we say, let's get a big ball of turkey, big ball of ham, big ball of chicken meat, right? And I worked in the deli slicing this meat, and it never occurred to me, there's no meat this big in a bird or a ham. I was like, where's the bone? But then when I was raising chickens, I realized that meat's bigger than the whole entire chicken. So what the hell are they doing? And what they do is they glue the meat together. So they take all the scrap meat, sprinkle tissue transglutaminase on there, which is derived from pig's blood, compress and refrigerate that ball of meat for 2 to 4 hours, and it comes out one solid piece of meat called meat gluing. But if you take external meat and put it on the inside of meat, then you have a high risk of food poisoning. And as Americans, we're problem solvers. We're not going to stop gluing meat together because that's crazy talk. We have to glue meat together because that makes sense. So what could we do? I got an idea. What if we take cancer-causing nitrates and we can saturate the meat, then glue it together, and now it's more likely to cause cancer than smoking cigarettes, according to the World Health Organization. But still profitable. So don't worry about that. Your stock dividends will not go down. People will just die. So you should invest in processed meat and chemotherapy. That's great. America, right? So nitrates that are in those processed meats like sausage and bacon and hot dogs and all that nonsense. Not only does it's a big thing for migraines and bloating and all this kind of stuff, but it's cancer causing. What about, so Carrie says so gross, right? And this is America. We eat pink slime. We go to Taco Bell, which boasts 50% of their stuff's made from meat. 50%. Like they had a big beef burrito that they had to rename because it did not meet the legal definition of beef. That's America. So, if we eat a bunch of nitrate-rich stuff, and the same thing when it says naturally occurring from celery juice, it's the same problem, right? It's like organic tobacco versus synthetic or toxic or polluted tobacco, right? It's just like, should I get organic meth and lose all my teeth, or should I just get the regular street meth and lose all my teeth? It's the same problem. So processed meat should equal reflux. Coffee, black tea should equal reflux. Red Bulls should equal reflux. Guess how you solve it? Yeah, stop eating that crap. Then there's sulfites. And so some people have sulfite sensitivities that will cause reflux or urinary leakage. And so that's, wines will have that in there sometimes, but you can buy sulfite-free wines. Your big one is Chinese food, or not from China, because they eat totally different than they feed us. And I think it's good payback, because what Americans did to the Chinese for the labor camps and the railroads, they're getting us back with Chinese restaurants and just killing us a little bit slower, which is great comeback. So, sulfites are in like Chinese food. If you go to like the Asian market, you really have to pay attention to finding things that are not preserved with sulfites, because that's instant reflux. Then we have things like high glycemic foods. So last week when we talked about what does the world eat, we said what the world eat, what do Americans eat? Americans! And it's like we had 2,000 pounds of food that we posted last week, right? Half of that is dairy. If you recombine it another way, about half of it is sugar. So we're back to sugar. Sugar dramatically increases sympathetic nerve. So then high glycemic, or things that convert to sugar very rapidly, you should have reflux with it, right? So Wonder Bread versus a whole grain bread. Paleo bread versus wheat bread. That kind of difference. That'll make a huge difference in how much reflux you have. And really, the goal should be 0. And 0 should be pretty easy to get. But you have to change what you're consuming. And then we have wheat and dairy. Dairy's the devil, and wheat's his perverted uncle that lives in the basement. So, wheat or gluten ends up being a huge one, which if we go back to the glued meat, tissue transglutaminase is the chemical that messes up celiac patients and non-celiac gluten-sensitive people, which is everybody else. So, in America. Overseas, you don't have to worry about that so much, but glued together meat is like eating bread in America. But most people don't think that. Who would think that, right? So wheat and dairy, and so if somebody's like, well, I got to do kefir because it gets fermented. Well, do non-dairy kefir, do Kavita, or do kombucha, or do those kind of things. But try not to do American dairy, American wheat at all, or gluten, which is rye and barley and malt and all those things. Then you have food sensitivities. And that tends to be, first do the easy stuff. If you get rid of all these foods, change those little lifestyle things, it should just go away. If it doesn't go away, then it's I think it's the H1 histamines. And that's driven through this stuff, which we probably talked about before. And I posted mine on here before too. But this is a sample one. And you can see on here, it's probably backwards, but you can see that these are someone's food sensitivities. And so every time they eat these foods, they then have reflux or irritable bowel or Crohn's. And so you just got to identify and then eliminate them. But what's interesting is we go through this. So this is someone's. This might have been mine. But green tea is high for this person. So where green tea, they should be drinking a lot. Green tea might be reflux for them. Wheat and dairy is always a problem. But if they did millet, they were high on that. Oats, we had another oat patient. Well, this person sucks because they're allergic to rice, oats, and millet, which is the big bulk of your gluten-free stuff. So they would have to change the amaranth and arrowroot and maybe buckwheat, sorghum, tapioca, and then they wouldn't have the reflux. Watermelon, pineapple, 4th of July should be that. Yeah, cauliflower, Brussels. I mean, they have all kinds of stuff that I would encourage them to consume, and they would end up with more reflux and autoimmune conditions because of that. So this thing becomes the key to kind of solving those complex ones, but for the simplicity, always try the other stuff first. So chocolate, nitrates, sulfites, high glycemic foods, lots of sugar. The Americans consume about 150 pounds of sugar a year now, of added sugar. So like Cheetos might say sugar once, but there are 7 other names for sugar that's in there, things that are rapidly converted to it. And one of the things you see all the time is maltodextrin. And maltodextrin is sugar plus sugar plus sugar, and it breaks down that fast, so it's like triple sugar. So Jennifer has a question here. I've been off all that stuff for the last 9 months, so shouldn't be having reflux then, right? No, that's exactly it. So this is that next step. So I don't think we've ever had to go past that, but typically wheat and dairy is that first thing, like, oh yeah, it's gone. Then it's nitrates and MSG. Oh, MSG's in there too, and chocolate for some people. But once we've exhausted those very basic things, and we've gotten rid of the most likelies, and you've changed that from standard American diet to more of a healthy, sustainable, consistent life and longevity kind of diet, then it could be healthy things. That's when you do the IgG, delayed sensitivity testing. So Jennifer, that's probably your next step. If you've done your due diligence and you've gotten rid of those things, then the next step is to do the food sensitivity, identify the foods that are probably healthy that you're consuming, and then boom, it's gone. So does that help? Have you done that before? So post if you have, if you want to. But that's what I would do next. And you can get that done pretty much anywhere. If you have trouble with finding someone who does it, let me know, and I can try to help you too, if you're out of state or something like that. All right. So that tends to be the fastest, easiest way to fix reflux. And really, it should be super easy to fix, because just like most all conditions, the easiest way to reverse it is to stop causing it. It's just nobody talks about how we cause it. So if you don't know what causes it, you can't stop doing that, and then you end up with chronic management, whether through natural medicine or through synthetics. So whether you go get drugs or whether you go to a clinical nutritionist and they just prescribe you 20 things for the rest of your life, what we do here is a little different. We do that functional lifestyle medicine. So how does it work? What do we do to mess it up? How do we restore normal physiology? And then that's the long-term fix. So yeah, Jennifer, so you said you hadn't. So that would be the next step. So Facebook me, let me know where you live and if you have questions about it, but that's your best option next. All right. So any questions that you guys have, keep posting those. I know we changed topics tonight because our guest wasn't here, but we'll have Connie back on. That's a very fascinating topic, the neuroplasticity, epigenetics. It's pretty good. We can rewire the brain, which is amazing, but with that nocebo effect versus placebo effect, we literally can change how we wire things based on how we think about things, which to me, it blows me away. I think that's amazing. And I love that it's not quirky or kind of quacky kind of stuff, that it's hard science, peer-reviewed research, good stuff. Okay, so as we wrap things up, I wanted to reiterate, please share this with your friends and family, and like the video if you like it. We're going to plan a shopping trip coming up, so we like to encourage kind of people to show up, and sometimes we divide up, but we'll kind of go through and answer questions that you have when you're at the grocery store, and hopefully we'll have some of our long-term people, and they kind of help you too. We'll talk about apps that help with purchasing things. We might actually break the store tour up into a couple different weeks, so we talk about maybe fruits and vegetables, and then we talk about cleaning products, and then we talk about beauty products, that kind of thing, because sometimes I think we spent like 4 hours in just the beauty cosmetics area last time. It was pretty crazy, in supplement area. And then we're going to plan a women's retreat. That's with Scott Spradlin and me. He teaches dialectical behavioral therapy. He's also the one who leads the meditation group that I go to. So he's a great therapist. But what we want to do is involve yoga, meditation, mindfulness, different workshops and teaching classes that basically you can come and spend all day and really get some life-changing information as you go through it. And then the last thing was, we're still waiting on my genetic report. Thought it would be here by now, but I'm hoping by next visit we'll have that, and we'll go through my genetics on here, so you'll get to see what is Dr. G made of. It's probably just sugar and spice. I mean, that's probably all it's going to say is 25,000 genes that regulate sugar and spice. But I probably have a few with sassitude too. And sarcasm genes. Probably lots of sarcasm genes. So, alright. Thank you guys for attending. I really appreciate it. I'm glad that you're part of this. Thank you, Stephen. As you guys post questions, keep posting those even after we go off the air. That's fine. I'll try to answer all those for you. As you guys have topics and suggestions for the show, please don't hesitate to let us know. And then hopefully we'll get Connie back on, get her rescheduled. She's a busy woman, but she's got great information. She does like really powerful stuff. She does retreat to joy, and she's involved in so many wonderful things. So she's a real asset to have on here, and so we can pick her brain too. We'll have Scott Spradlin back on. If you guys have any other kind of guests you think that we should have on here, please let me know. Sometimes you like, oh, it's Dr. Garrett again. We'll have Holly on again too when we talk about hormones. So it'll be Dr. G and the boss again for a while. So, all right. Thank you guys for attending. I love you guys. Have a great week. I'll see you next week, and we'll figure out. We'll play a little bit loose. Probably going to talk about genetics. Maybe talk about neuroplasticity, or we may talk about something else. But let me know what you guys want to hear about, and we'll play it by ear. All right, guys. Bye. Have a good night.